And we want to begin with that dire warning over the true cost of Australia's coronavirus fight. 1.4 million Australians out of work by June. That's the prediction from the Treasury, but it could have been much, much worse. Is the end in sight? The National Cabinet set to discuss coming out of shutdown as the World Health Organization issues a warning against moving too soon. COVID-19 testing for anyone with mild symptoms in Sydney virus hotspots, and light at the end of the tunnel for New York. The governor declaring the worst is over.
OK, well, let's take a look at our country's infection curve, and there are now more than 6,300 confirmed cases in Australia, which increased by just 1% yesterday. 61 people have died, but encouragingly, there are now more people recovering than there are sick, close to 3,500. Around Australia, there are more than 2,800 cases in New South Wales. If we look to Victoria, it's sitting on just over 1,200. 987 cases have been confirmed in Western Australia. I should say Queensland, actually. WA is sitting on 523. South Australia is next on 431. Tasmania has 150 confirmed cases. The ACT 103, and the top end remains on 28.
Live to our team of reporters this morning now, and first to Fiona Willen in Canberra as Australia braces for double-digit unemployment figures for the first time in 26 years. Fee, how many more people are expected to be out of work?
Well, Carl, new analysis has found 700,000 Australians could lose their jobs by the middle of the year, so that would mean around 1.4 million people out of work. Now, this modelling by the Treasury estimates that we're heading for an unemployment rate of 10% in the June quarter. So in February, it was sitting at 5.1%. However, the analysis also shows that things were expected to be much worse when the lockdowns were announced and businesses started closing their doors. Treasury had expected unemployment to triple to 15%, but something likely to prevent that sort of increase is the $130 billion JobKeeper program, which was passed by Parliament last week. So that scheme will provide wage subsidies of $1,500 per fortnight to struggling businesses to help them keep paying their staff. More than 800,000 businesses have now registered for those payments. Carl.
Fee, thank you.
There's light at the end of the tunnel with the National Cabinet set to discuss exit strategies to ease restrictions. Jessica Millwood is in Brisbane, and Jess, it's a difficult balancing act, isn't it?
It is, Ali, and the World Health Organization is warning governments right across the world to not move too quickly when it comes to this. They've released some guidelines that governments do need to consider when lifting tough restrictions around social distancing. They do include controlling transmission and making sure that you can do that going forward, minimising outbreaks in vulnerable locations, places like nursing homes and also hospitals, restrictions in essential locations, places like workplaces and schools, and making sure that we can control the risk of the virus coming in from abroad. Here is the World Health Organization.
The way down is much slower than the way up. That means control measures must be lifted slowly and with control. It cannot happen all at once.
The good news is the curve is flattening in Australia. Just 46 new cases nationwide yesterday. But the longer all of this goes on, we know that the economy is hurting and the government would be very conscious of that. So when the National Cabinet meets on Thursday, they will be discussing a roadmap out of all of this in terms of a timeline. Restrictions would not be eased in days, more likely weeks. Ali?
And we will watch that very closely. Thanks, Jess.
It's Australia's super spreader, and the Ruby Princess cruise ship is in more trouble again this morning. Nine's James Wilson is in Port Kembla, south of Sydney, where the ship is docked. Good morning, James. There's been breaking news there overnight.
Good morning, Alex. That's right. A 24-year-old man on board the Ruby Princess has been rushed to Wollongong Hospital overnight, suffering from coronavirus. He's now the 66th crew member to test positive for the virus. It brings the 11 other crew members, have been taken to hospital with coronavirus. Now, this ship was due to depart from Port Kembla on Thursday, but those plans are growing increasingly unlikely as this health crisis unfolds on board. In the meantime, police investigations believe that they are tracking down patient zero. They're currently focusing that investigation on the ship's galley, where crew members are responsible for serving food. Alex, will have more on that as the day progresses.
James Wilson, thank you. The fallout from the Ruby Princess is being felt now in Tasmania, where 5,000 people are now in quarantine after a virus cluster forced the closure of 2 hospitals. The plagued ship accounts for half of the state's 144 cases, 43 of which are health workers. The Northwest private and regional hospitals will be shut down for a fortnight.
In a bid to slow community transmissions, New South Wales is stepping up testing in huge parts of Sydney. Today's Gabrielle Boyle is outside an aged care facility near Penrith where there is an outbreak. Gabby, what areas are considered hotspots?
Good morning, Carl. Well, I can tell you there's many parts of Sydney that have been identified as hotspots. Health authorities are trying to stamp these out as quickly as possible. And one of their strategies for doing that is to make sure that testing is available as quickly as possible. So they're saying to anyone with even mild symptoms that could be COVID-19 to come in and get tested as quickly as possible. If you're wondering whether you live in one of these areas, well, let me run you through the list. The eastern suburbs, Ryde, Penrith, Liverpool, Blacktown, Cumberland and Westmead, and of course the inner west, just some of the areas that have been identified as major coronavirus outbreak areas. And as you said there, Carl, I am standing in at the front of one of these health facilities where the virus has broken out, the Anglicare Newmarch House, which is an aged care facility. We've now learned that 6 staff members have tested positive to COVID-19, and the fear really is that they could spread it to some of the most elderly and vulnerable in the community out here. They are caring for those people and really shouldn't be exposing them to the virus. Hopefully it hasn't spread any further, Carl, but I can tell you that 6 staff member has been stood down and placed in isolation.
Yeah, it's a big worry, Gabby. Thank you.
A top Victorian cop has warned officers to use common sense or risk losing public confidence as police enforce social distancing laws across the state. Isabella Stashkovsky is in Melbourne for us. And Isa, have officers taken the crackdown too far?
Well, Ali, it's certainly a question that is up for debate this morning, especially when you consider a number of these fines have now been revoked. Deputy Commissioner Shane Patton says officers need to weigh up whether a person's actions are actually putting others at risk. There have even been a number of mistakes. One couple in Gippsland copped a fine of more than $1,600 when they put a photo of themselves on holiday up on Facebook. The problem was that photo was taken a year ago. Now, the inconsistencies continue in councils. For example, here where we are in the Moonee Valley electorate, if you take your dog for a walk, it now has to be on a leash. The Mayor says that's to enforce social distancing, but a number of residents we've spoken to here this morning says that new measure is just ridiculous. Ali?
OK, thanks for the update, Isa.
The government is close to signing off on a multi-million-dollar funding package to keep Qantas and Virgin Australia afloat. The deal will help domestic routes stay open and ensure fares remain affordable for travellers. Some are concerned bailing out the airlines is unfair to other business. Here's what Bill Shorten had to say about that on the show just a moment ago.
An airline's not a coffee shop. It took 10 years to get Virgin to where it is, and just going straight back to the bottom and starting again, I think will be a long-term mistake.
The deal would be on top of the $1 billion already committed to the aviation industry.
And all or nothing approach to eradicating coronavirus is the only way forward, according to Queensland Premier Anastasia Palaszczuk.
No longer is it a matter of flattening the curve. She's boldly declared she wants to smash it, and she joins us now. Premier, a very good morning to you. Thank you for your time again this morning. Them's fighting words. Can you bring us up to speed with the numbers overnight, please?
Well, we've just had, it's literally just come to hand now, Carl, and we've had 11 positive cases overnight. So we are seeing definitely that flattening of the curve in Queensland. And what a remarkable result, 35 over the Easter long weekend, 11 tonight. So we're really going well in terms of flattening that curve. And like I said, let's smash it.
Yeah, well, we like to see the smile on your face, but is there an issue that there are fewer cases because there was less testing over the Easter weekend? Have you taken this into account, and will you roll out more tests so we do get a more accurate read?
Yeah, Ali, thanks for that. And we've already started that. We started that last week. We have expanded our testing into Cairns, the Gold Coast and Brisbane because we thought there was some unidentified small amounts of community transmission, and those tests have been happening. And the last count, I think there was over 75,000 tests that have been done throughout Queensland. So I'm more than confident that the testing regime is working. And we're still seeing, of course, a lot of those overseas travellers returning back that are testing positive as well. So some good news, I think, for Queensland and also for Australia as well. So it's great to see. So well done, Queensland.
You've been working incredibly hard, even in your tone and in the way that you are smiling this morning is an indication of some of the relief you must be feeling. That being said, complacency is a possibility here amongst Queenslanders. And then you have to talk about when you might lift restrictions, which could lead to even more complacency. It's a delicate balancing act, isn't it?
Yeah, it is delicate, Carl, but Queenslanders have done very well, but we need to get the balance right. And look, the Prime Minister has said to us, and we've been very strong, that we are looking at 6 months here, but we need to make sure that we are still doing the social distancing, we are staying home as much as possible. And I don't think people can feel complacent that just because we've had low numbers, that's the end of it, because what we're doing is we're flattening the curve. If you lift too early, of course, you see what's happened in other countries where those high rates of infection are causing their hospital systems to reach full capacity, and we don't want to see that happen in Australia. So it's a big effort of everybody, and I think everybody's working collaboratively together. It's great to see.
Yeah.
But at some point you will look at easing restrictions. Do you have an idea now of what that will look like and when you can start taking those first initial steps?
Look, the modelling's happening at the moment. Like I said, we're still waiting on that modelling for Queensland into the future. But of course, we've got to get the balance right. I think we're in a unique position here because now we can actually see some of those European countries lift restrictions after going through those high spikes. And I think we can get a gauge on how that's working. The World Health Organisation just said this morning too that it is very important how you ease those restrictions. So I don't think now's the time for complacency. Everyone's doing a great job, but we've only just gone into this stay-at-home and social distancing. It's only been working for 2 or 3 weeks. This is a long haul. It's a marathon. I've said that several times before. So, you know, let's take each day as it comes and see how we go.
You'll have businesses champing at the bit to get out there and to get involved and to start, opening up their doors again, won't you? The NRL and broadcasters will meet today to discuss plans to restart their season next month. Are you in favour of that?
Carl, I love the footy as much as you, as much as everyone else. I mean, I think it's devastating. We're not going to see the State of Origin this year as well. But look, I think we have to be very realistic here. We have to take the advice of health. If New South Wales has different health advice to me, go for it. But we have very strict health advice here, and I'll be listening to my health experts. That's not to say that footy won't return in the future. But we can't pinpoint a date on that at the moment, and I'm just concerned it's sending a little bit of a wrong mixed message out to the public at the moment when we're asking them to stay home and do the right thing. All you need is, I'm really concerned about my Queensland players, frankly. Going down to Sydney, all you need is one community transmission down in Sydney and the whole team could possibly have it. So I am very concerned about Queensland teams going into New South Wales. It'd have to be very strict quarantine. I'd have to get health advice from my chief health officers. So I'm sorry, I don't want to put a spanner in the works here. But look, we're either going to listen to health advice or we're not. I'm not making any apologies to that. I listen to the health advice all the time. I listen to the experts.
And you just said there will be no State of Origin this year.
She didn't mean that.
I think she did.
I hope there's not. Well, we always have a State of Origin, but how can you have it? I mean, maybe in December. Let's keep our fingers crossed.
Queensland students, Premier, as well, will learn from home for the first 5 weeks of Term 2. There's been some level of concern about kids who may not have the facilities and may not have the wares and may not have the money to be able to have some of the resources that other kids do. Are there going to be kids that fall through the cracks here?
Oh, look, we're really confident that we've struck the right balance here. So schools will be open for essential workers. And people say to me, what's an essential worker? Well, it's anybody who has a job in the workforce at the moment. And we want those kids going to school and kids, of course, from vulnerable backgrounds as well. We're very confident that we can help with some SIM cards for students, but also we're actually talking to some of our commercial networks, Channel 9 included, to see if they can come on board and actually help deliver deliver some lessons as well for our students. So I think if we get that right mix, that online learning, some television content of teachers teaching classes, I think we'll get the balance right there. And it's uncertain times. So thank you, everyone, for your patience and your understanding.
Can Carl tune in?
I'd be delighted to be a teacher.
I'm thinking more of a student.
I don't know. Do you have your qualifications, Carl? I don't know if we'll let you loose in the classroom.
I did go to university. I just can't remember what I studied, Premier.
Something at the pub, I believe.
Hey, thank you, Premier. You've been working incredibly hard. It's very promising news, and we know there's a long way to go, but thank you for all your efforts. Appreciate it.